The human abdomen, a complex web of organs and tissues, each playing a vital role in the intricate dance of life. And there, nestled within this intricate landscape, lies the bladder, a small yet powerful organ, often overlooked until it demands attention. The bladder, a reservoir for waste, a humble servant to the body's needs. It expands and contracts, adapting to the ebb and flow of liquid that passes through it. It silently performs its duty, holding on to the body's waste until the time is right for release. But sometimes, the bladder rebels. It protests against its confinement, sending urgent signals to the brain that cannot be ignored. The sensation of a full bladder, a pressing need that demands immediate action. The body's natural alarm system, reminding us of our mortality, our vulnerability. And so we rush, seeking relief, seeking release. The act of emptying the bladder, a simple yet profound moment of liberation. The sound of liquid hitting water, a symphony of relief and satisfaction. The bladder, once burdened, now lightened, ready to resume its quiet service. But the bladder is not invincible. It can be a source of pain and discomfort, a reminder of our fragility. Infections, stones, tumors. The bladder is not immune to the ravages of disease. It can become a battleground, a site of struggle and suffering. And yet, the bladder endures. It perseveres, resilient in the face of adversity. It reminds us of our humanity, our interconnectedness with the rhythms of nature. The bladder, a humble hero in the grand narrative of the body. So let us not take the bladder for granted. Let us honor its silent service, its quiet resilience. Let us listen to its whispers of need, its cries for attention. For in the humble bladder, we find a reflection of our own mortality, our own vulnerability. And in that reflection, we find a reminder of our shared humanity, our shared journey through the labyrinth of life. The bladder, a small yet mighty organ, a testament to the beauty and fragility of the human experience. Bladder cancer is a serious condition affecting the organ responsible for storing urine. Let's explore its types, causes, symptoms, and prevention methods. The bladder, situated in the lower abdomen, plays a crucial role in the urinary system. It receives urine from the kidneys through the ureters and expels it through the urethra. There are three main types of bladder cancer. Transitional cell carcinoma originates in the innermost tissue layer of the bladder, known as transitional cells. Squamous cell carcinoma develops from thin, flat cells and can arise due to prolonged irritation or infection. Adenocarcinoma begins in glandular cells within the bladder lining. Bladder cancer can be categorized into superficial and invasive stages. Superficial cancer affects only the bladder lining, while invasive cancer spreads deeper into the bladder wall, nearby organs, or lymph nodes. Early-stage bladder cancer often exhibits no symptoms. However, as the disease progresses, signs such as blood in urine, frequent urination, urgency, and pelvic or back pain may occur. While definitive prevention methods are elusive, certain lifestyle choices can reduce risk. Avoiding exposure to carcinogens found in industries like hair dye and paints, maintaining physical activity, and abstaining from smoking are crucial. A balanced diet rich in fruits and vegetables, particularly cruciferous varieties like broccoli and cabbage, is recommended. Adequate hydration and avoiding fried meats and excess fats can also contribute to lowering the risk of bladder cancer. Depending on the stage of the cancer and other factors, treatment options for people with bladder cancer can include bladder cancer surgery, intravesical therapy for bladder cancer, chemotherapy for bladder cancer radiation, therapy for bladder cancer, immunotherapy for bladder cancer, targeted therapy, drugs for bladder cancer. By understanding the types, causes, symptoms, and preventive measures of bladder cancer, individuals can take proactive steps towards better health and well-being. Remember, early detection and timely medical consultation are key in managing bladder cancer. Stay informed at Daddy Medi and prioritize your health.